Okay.
Okay, so I made a brochure. I am not technical, so pretend it's double-sided. You guys can get copies tomorrow. So DMD, or Duchenne muscular dystrophy, is caused by a genetic mutation in the DMD gene, which provides instructions for protein dystrophin. It can The mutation can be inherited from a parent, or it can occur spontaneously. It's located on the X chromosome, so mainly males inherit the disease. Without enough dystrophin, muscle cells become fragile and die, and it leads to muscle weakness and heart failure. So some things we can do, or the history, I can start with the history. 1834 was the first time anybody described the disease, but in the 1860s, a man named, Benjamin Amand Duchenne named the disease after himself and discovered the disease, even though it had been documented earlier. So how it affects them, the symptoms: difficulty walking or climbing stairs, frequent falls, waddling walk, calf muscles that are larger than normal, weakness in the shoulders and pelvis, facial weakness, difficulty rising from a seated position, and inability to run or jump. Some long-term effects are bone thinning, scoliosis, stiff joints, shortness of breath or other lung problems, irregular heartbeat, other heart problems, need for wheelchair, and cognitive and behavioral impairments. So there are a lot of different treatment options. You can use medication, you can use gene replacement therapy, physical therapy, which would go along with another form of treatment, and also constant cardiac appointments to make sure the health of the heart is staying up. Respiratory support. Sometimes we'll need breathing devices once it gets to the end stages, and nutritional counseling to try to get as good as a diet as you can. Prognosis. It's like a progressive disability, so it progressively worsens over time. In the recent years, there's been an improved life expectancy, and while the prognosis is still considered poor, advancements such as corticosteroids and exon skipping therapies have made the disease much more manageable. The age of onset usually is between the ages 2 and 5, and it can lead to some serious respiratory and heart complications, which is usually what kills the patient, not the actual disease itself. It's the deterioration of the heart and lungs. We can support people with DMD by giving companionship and supervision, rides to medical appointments, light housework while tolerated, preparation of meals, bathing, dressing, other personal care, and mental health support, which can be a big problem, especially with the developmental delays that can be with DMD. And other support, you can get a social worker or a psychologist. Trained service animals help a lot, and home modifications can make life with DMD a lot more manageable.